A great part of the success of our transition into a new normal amid COVID-19 depends on the protection offered by vaccines. The finding, though, is that vaccine-induced immunity weakens over time, and today we seek a better understanding, that is, of the options available given this reality. For more, I have Dr. Alice Hyungyung-Tan from Ms. Medi Women's Hospital. Welcome back, Dr. Tan.
Thank you for having me.
I also have Dr. Kim Sing-Taek from Institute Pasteur Korea. It's good to have you back, Dr. Kim.
Good afternoon.
Dr. Dan, Wednesday's tallies are believed to be a better indicator, that is, of the country's current COVID-19 situation, given the greater number of testings and the absence of the weekend factor. Having said that, what are your thoughts on our current situation?
Well, there are two bits of what we might say good news. The first is that the number of daily cases has not expanded dramatically to the 3,000, 5,000, 10,000 range that we feared. The second bit of good news is that test positivity remains less than 2%. So that means that the number of tests being done are adequate for the amount of transmission. But there are some troublesome trends. First of all, the reproductive number has increased now to 1.2 in the capital region, 1.22 in the non-capital regions. And what this means is that cases will increase. That's something that we can anticipate from this one number alone. I'm also concerned because the positive cases in people age 60 and older, since November 1st, this number is greater than 6,000. And so this was not surprising this morning when I saw the number of ICU cases at 640. We could anticipate, because there were so many senior citizens getting COVID-19, we would have an increased number of people needing ICU care. The other problem, though, is that more than 80% of the 640 people in ICUs are aged 60 or older. And so what this means is that we can anticipate, unfortunately, the increased trend in the number of deaths per day. Unfortunately, the number of weekly deaths during the first week of November was more than double the number of weekly deaths over the first week of October. And so, unfortunately, this is something that we may have to brace ourselves for in the near future.
Right, because the number of people in severely ill conditions, that is, stood in the 300 level for weeks, and then starting this week it rose to 409, 425 and now 460 as of this Wednesday.
Right.
Right. Dr. Kim, now, following talk of waning vaccine protection, authorities in quite a number of countries, including Korea, are highlighting the importance of booster shots. Right. What can you tell us about recent findings related to the effectiveness of booster shots?
Well, there was some interesting paper published in the Lancet, very recent one. And then actually there was a couple more, just a very similar study conducted in Israel, because Israel actually just the country that conducted sort of just a nationwide booster shot campaign. So even just the Israeli prime minister said that publicly that their country might just supply some data for some large-scale clinical trial. And I think this is just sort of data from those kind of just massive just a booster shot campaign. So in the end, they actually just this is the kind of a statistical analysis from the more than just the 700,000 the people from each group. Actually, just the people. The one group is from the people who finish it the second shot, and the other group is also the third shot, including just the booster shot. So in the end, in terms of percentage-wise, the booster shot people show some reduction in the hospitalization by 93%, and then also reduction in the severe COVID-19 by 92%, and also the reduction in the death case numbers by the 81%. But at the same time, we have to actually compare the two groups. Those two groups are well, the authors actually try to just make the equal. I mean, the kind of just comparable groups. But then it's not really identical, because for the second shot, the vaccinated group, they actually just the group the people with the finished the second vaccination at least more than 5 months ago. But for the booster shot, it's at least more than 7 days ago. So that in terms of just the vaccine immunology, this booster shot, just the people with the booster shot, they actually just show some more of just showing just more of just a neutralizing antibody, at least for them. And so this is not really just we cannot compare by in this case side by side. And then this is pretty just well known. And for the efficacy of the booster shot, this is kind of just the issue of just the debate. And then even just just a couple months ago, there was some debate even in between just some Biden administration and also some FDA person. So at this moment, there's some general consensus among the scientists is that while the antibody is just the amount of antibody is just waning, that's for sure. But that's the kind of the circulating antibody. This is pretty well known fact. But we are somehow at this time we are also neglecting the some of the memory response. The memory response is actually just a response when it actually just encounters to the pathogen. But by some vaccination, the memory response is actually memorized the immune reaction. And also, we are also just in this case neglecting some T cell responses, which is just immunity, just induced by just immune cells. And then, especially for the sort of just T cell response, it's now known that very long lasting, and also very long lasting, and then also very effective, just preventing the severe COVID-19. So there's some pros and cons, and then I think generally there are some most consensus is that the booster shot is probably just necessary for people with some high risk groups. For example, like the people with the age 65 years and older, and also the people with some underlying just medical conditions. And then additionally, there's some differences in terms of just when we just talk about the efficacy of the booster shot, because in the case of Israel, the definition of the severity is actually a little bit different compared to the standard that which is being used in the U.S. And also, as I told you, based on this study, we cannot tell for sure the long-term effect of this booster shot as well. So I said for second shot, the finished second shot, there's actually just people with more than the 5 months ago. But here, just for the booster shot, just 7 days, at least 7 days ago.
Right. And staying with booster shots, Dr. Dan, there are mixed views with regard to the type of vaccine to be offered as a booster shot, depending on what the initial vaccine was that had been administered on the person. Having said that, do share with us your thoughts on this matter.
Well, first of all, the one opinion is that whatever worked for you the first time, if you didn't have any severe side effects, go ahead and just get that the second time. Just stick with what works. That just makes it a lot easier. The second issue is heterologous prime boost. In other words, using different vaccines, mix and match for the primary series and then for the booster. There are two major studies looking into the effects of boosters. That's the COMV study in the UK and the mix and match study in the United States. Both studies are still ongoing, but the preliminary results from the mix and match study from the US showed that any combination of the 3 vaccines that are authorized in the US, except for the J&J followed by J&J, any combination actually showed, we say, a post-boost neutralizing geometric mean titer greater than 100. What this means is any combination of prime and boost showed probably efficacy of greater than 90.7%. The highest immune response was actually seen, interestingly, in people who received an mRNA vaccine after the J&J. Also, Johnson & Johnson, the company that makes the Janssen vaccine, they said in their own research that using 2 doses of their vaccine 2 months apart increased vaccine efficacy from 70% to 94%. So we can't really compare the numbers because the way that the research was done was not powered, we say, to allow for direct comparisons. But the conclusion, the bottom line is, whatever vaccine you use as your booster should be good enough. If you had problems with one vaccine, then perhaps you should choose another.
Right. Here in Korea, though, those who receive the Janssen vaccine are being encouraged to get an mRNA vaccine, right?
Right, and it should work just fine.
Right. Now, meanwhile, a recent study published in the Lancet Infectious Diseases shows vaccinated people are just as likely as their unvaccinated counterparts to pass on the Delta variant, especially within household settings. For more, I have Dr. Anika Singanayagam at Imperial College London live on the line. Doctor, welcome to the program.
Thank you.
Right. Now, Dr. Singanayagam, so you co-led this study that shows the peak viral load within vaccinated people when infected is similar to that of their unvaccinated counterparts, rendering the former just as likely to spread COVID-19, especially within living quarters. Could you tell us a bit more about your study?
Yes, so we carried out a study in UK households around the time of the Delta variant transmission. And this was quite a detailed study. It's a labour-intensive study, which is why it's given us some unique information. What we found from the study is the way we carried it out is we recruited cases of COVID-19 in the community. So those are people who present to our contact tracing system with symptoms of COVID-19. And when we identified one of those people, we recruited their contacts, their close contacts, most of these being in households. And we followed those contacts with regular sampling to try to understand who became infected and what happened during the course of their infection, looking at the amount of virus in their nose and throat. And what we found was that in household settings, which is where most of our participants had contacted the case, in household settings, 1 in 4, so 25% of people who were fully vaccinated were catching the infection from the case of COVID-19 in their household. This was a lower rate, fortunately, than unvaccinated people who were exposed in the household. They were catching COVID-19 at a rate of 38%. So although vaccinated people are still at risk of catching it, the risk is somewhat lower than unvaccinated people. The other way that we looked at the information was to what extent are people who are vaccinated able to spread the infection within their household. The way that we did this was to look at that case, the index case, we call it, of COVID-19, and how much they were spreading the infection to their household contacts. And we found that in our study, the people who were fully vaccinated caused as many cases in their households as the people who were unvaccinated. The important things to remember when you're thinking about the results of our study is this was carried out in households. Households are special situations where a lot of transmission happens. It's quite easy to get infected from a household contact because you're in such close proximity to them. You share bathrooms, you share kitchens, you're hugging your household contacts frequently. And so, this data is, I would say, we need to remember that it's somewhat specific to households, and any differences in the infectiousness of cases may not necessarily be seen in households that may be apparent in other settings where you're not in such close contact with people. However, as you mentioned, we also looked at the amount of virus in the nose and throat, the viral loads of people, and we tracked that in some detail by taking samples each day from the contacts. And we looked at people infected with the Delta variant, but also the previously circulating variants in the UK, including the Alpha variant and some of the pre-Alpha strains. And we found that the vaccinated people did have similar peak viral loads as unvaccinated people. However, they clear the infection from their nose and throat faster than the unvaccinated people. So the vaccine is, perhaps causing you to have an immune response that helps you to clear the infection quicker. The important thing to remember about that finding is we're looking at using PCR tests, which are, the common way that we test for virus. However, it doesn't tell you anything about the infectiousness necessarily, and so it's an important finding to see that we're seeing similar peak viral loads, because this is probably where a lot of transmission is occurring, and suggests that vaccinated people are capable of spreading the infection, but it doesn't necessarily give us the answer as to whether they're spreading it as much as unvaccinated people in all environments.
Right.
That needs more work.
Right. Dr. Singanaya Gum, I understand roughly 80%, that is, of the UK population is fully vaccinated. Is that correct at the moment?
Yeah, I believe so.
Right. And yet daily infection numbers remain well above 3,000, 30,000 cases, that is, on a daily basis. How do you explain that reality?
In the UK, there are many factors that will be contributing to that. First of all, in the UK, many social restrictions have been eased. So there are really very limited restrictions on our daily lives now, including the use of masks being, relatively sparse, I would say. And, people are at liberty to use masks or not in most environments now. So a lot of the case numbers will be, that will be contributing to the high case numbers. As well, what we're seeing is, a lot of the infections are in the younger age groups. So children who are in schools and colleges are the people who are getting most frequently infected. Of course, those people will then take the infection to their household members and others and transmit it. And we're just really beginning with the rollout of the vaccination program to those younger age groups.
Right.
And so it may be that we see more effect as that proceeds. Yeah. As well as that, as everybody's experiencing the Delta variant being more transmissible and more infectious, this will be contributing to high case numbers. And of course, as you've been discussing, the effect of vaccine waning will also. So I think there are many factors that contribute.
Right, and talking about vaccine, waning. Back here in the studio, Dr. Kim, what has been disclosed thus far about the actual length of protection offered by vaccines?
Well, the vaccination actually just started less than a year ago. So we do not know just the spectrum of the some immunity elicited by the vaccination for so far. But we do have some limited information. Well, so one of the immune responses induced by the vaccination actually is two responses. The one of the antibody response, and the other is the cellular immunity. But for the antibody response, as I told you earlier, antibody response is actually just decreasing. So that's why we are just generally talking about the immunity is weakening. But then, as I told you earlier, just sort of a T-cell response. That is, so far, we know that this is very long-lasting and effective, especially just against the severe COVID-19. And then even also just, this is roughly speaking, depending on the vaccine platforms, some scientists say some different vaccine platforms seems to different the strengths of some immune responses. Roughly speaking, some mRNA, the vaccine seems to just in this very high neutralizing antibody the production, whereas the virus vector vaccine, the adenovirus, seems to induce more some strong some T-cell responses. So this is kind of very interesting, just a phenomenon.
Right, that is good to know. Dr. Singanayagam, based on your study then, would it be reasonable perhaps to assume that achieving herd immunity is an unlikely scenario in the case of COVID-19 then?
So in our study, we did show evidence that fully vaccinated people can transmit to other fully vaccinated people. And so this means that, achieving that goal of there being adequate vaccination that other people who are unvaccinated, for example, cannot catch the infection will be more difficult. The extent to the level of immunity that vaccination and previous infection will give people that will help to reduce that is, I think, still unclear. However, vaccination and previous infection will contribute to reducing your ability to catch it and to spread it. It's just that thinking about how much vaccination and previous infection is required, or if that's even ever achievable, is something that I think we will learn over time, and that epidemiologists and modelers will be thinking in more detail about.
Right. Dr. Dan, what are your thoughts on hopes of ensuring protection of the minority group of unvaccinated people through the greater vaccination coverage of the majority?
Well, I think the totality of the information, especially what we heard today, is that we can't just depend on vaccination alone. In order to get protection, high levels of protection in our society, throughout the community, we can't just say, okay, we have nearly 80% full vaccination, we can all take off our masks and ease all measures. That's really not going to be a wise way forward. So I think people need to be very proactive about doing all of the personal hygiene measures, all of the infection control measures, prevention measures that we've been doing so far, keep them suspended at least through this winter season in order to protect those who have not yet been vaccinated. And also to the people who are greater than 80 years old who are showing now they have the highest rate of breakthrough infections in our country. So we do need to do everything we can to protect these people.
Right, we do. Dr. Singanayagam, what are some words of advice that you would care to share with our audience to ensure better prevention and health, that is, as we seek to live with COVID-19? Before you go, of course.
I completely agree. I think that the primary thing to consider is getting a vaccine if you haven't had it, getting a booster if you're eligible, and expanding the vaccination program as much as possible. That's going to be the key thing. However, vaccination won't protect us completely, and therefore we need to be mindful of using lots of other measures to protect us from acquiring COVID-19. These include things like good ventilation, particularly in enclosed spaces, using masks, washing our hands, and all of the measures that we have been using over the past 18 months. I think that these things will need to continue even going through the winter.
Right. All right, Dr. Singanayagam, thank you very much for your time and your thoughts.
You're welcome.
Right, back here in the studio, Dr. Kim. Now, given the concerns that Dr. Tan has mentioned regarding the probability that we'll be wearing our masks for a longer time, do you suppose the widespread availability of antiviral pills perhaps will allow us to take our masks off sooner, or perhaps will allow us a step closer to the normal that we once knew?
Well, I believe so. And well, actually, all the efficacy and the safety data are just as the announced by some two major pharmaceutical companies. I think it is possible, and then I would just compare those two drugs as the oseltamivir. This is the Tamiflu, therefore the drug for used for the influenza virus infection. And then actually one of the key issue for these drugs is that the accessibility, in terms of the cost, and then some production issues. And if it can be actually very easily accessed, in terms of this, and this is actually just substantially help to just facilitate, expedite the living with just COVID-19. And but also another factor that we have to actually consider at this moment is also diagnosis, because as of now, these drugs are not actually widely available. So that probably this drug would be available for the people with some high risk factors, probably elderly people with some underlying medical condition, and unvaccinated. So to just identify those people, then we have actually needed some fast diagnosis. So these drugs, both of these drugs, should be used for the people with COVID-19 within the 5 days of onset of COVID-19.
Right, symptoms. Yeah. All right, Dr. Kim, as always, thank you very much for your thoughts. And Dr. Dan, thank you very much for your insights today.
Thank you.